vulva, vagina, the cervix. Okay, okay. So first, we discuss congenital anomalies. Spelling. Ano nga spelling?
Bicornuate.
Marami pangalan, di ba? It can either be called bicornuate, because cornu is corn. No? So that's bicornuate uterus or uterus didelphys, PHYS. So if you notice, I'll orient you again. This is actually the uterus sliced na longitudinal. And this is just half of the uterus, and you see the serosal surface, and then the myometrium, and then the endometrial lining. The endometrial lining here. Okay, if you notice, this is the cervix and the lower uterine segment. So if you notice, from the cervix to the lower uterine segment, it ascends into two endometrial canals leading into what we call bicornuate uterus or uterus didelphys. So this is just one of the anatomic variations or anomalies that you can find. Pag nag-mens yung isa, mag-mens din yung isa. Okay? Pag nagbuntis yung isa, hindi naman siguro, I don't know, kung magbubuntis din yung isa. Depende, di ba? Pero, what the changes, hormonal changes that will happen in one lining will also happen in the other. Okay? So, doble ang bleeding. Okay. The next one, which is very important nowadays, it is actually just a portion of the uterus. No? If you, I'll give you first an example. So this is your usual uterus na nakatalikod, posterior side yan. So this is the cervix, and this is the area of the uterine corpus, the fundus. Okay? The serosal surface. And then if we slice it, ganun yung itsura niya. Okay? Ganun yung itsura niya. So this is just one portion already of the sliced uterus. Okay? Okay, identify na naman tayo. So, this area here is the outermost layer, serosal layer, and then this is the, what? Sumunod? Yung muscle. Myometrium. And then, yung epithelial lining is the endometrium. So this is the area of the fundus sa upper, and then going down, this is the area of the cervix. Okay? So in the cervix, if you notice, can you zoom? Okay. So in the area of the cervix,
Actually, sa transitional zone, endo.
yeah, ito mas kita. Okay. You see here that this portion here of the cervix is darker than the upper one, no? So this is already the transition from the normal to the malignant area. So this cervix has, ito maputi yung area na to. Ito, fleshy na brown. Ito, area of the malignant portion of the cervix. And if you notice, this whitish area here goes all the way up into the myometrium. So this was biopsied and was diagnosed to be squamous cell carcinoma of the cervix. So it usually starts down in the cervix and goes up from the lower uterine segment, going up into the area of the endometrial lining. Okay? So what is the most common risk factor for developing cervical CA? Okay, chronic infection with HPV. Subtypes? 16, ano pa? 31, 33. 15, 18, 31, yun lang yung tatandaan nyo. Kasi, yung apat na yun, sila yung target ng mga vaccines that we have in the market. Diba? Mga quadrivalent, yung apat. Pag bivalent na nawala. Okay. is a larger version, okay, of the uterus. Sliced pa rin siya. And orientation, ito pa rin yung cervix. This is the cervix. This is the cervix, the serosal surface, the fundus. Okay. Again, anong part ito? What part is this? The outermost part is the serosa, and then going inside is the muscle and the endometrial lining. If you notice, the area here, what do you notice? Flat siya, di ba? Endometrial lining. And then going up, it's very thickened, whitish, and friable. So this is the area where you have a neoplastic growth. This was biopsied and then diagnosed to be endometrioid adenocarcinoma, one of the types of carcinoma. You have not discussed this yet, but this is the only time that we will be explaining to you the specimens, okay? So, para mag-gets nila if you have your lecture. Okay, so this, if you see the glands here, the area here, are actually malignant glands. The staging will all depend if these malignant glands will invade into the myometrium. Sometimes, kino-quantify pa kung first half, second half, until extending outward into the serosal surface. So this is endometrioid adenocarcinoma.
Ayan, endometrial colon. Ay, pero tingnan mo.
What do you call the operation where the whole uterus and both ovaries are removed? Do you know? Hysterectomy, di ba? So in OB, we call it TAH-BSO, di ba? Total abdominal hysterectomy with bilateral salpingo oophorectomy. So that's Tabiso. Okay? So this is another Tabiso specimen. We call it Tabiso. Sige. Nasaan yung cervix? Talikod. Harap. Ito yung taas. Ito yung baba. So, nandito yung cervix. Okay. It takes quite a while to orient. Kasi matigas na to eh. If this specimen has not been sliced and formalinized yet, very rubbery sila na malambot. Okay? But we have to formalinize them to preserve them. So, this is the cervix, the uterus, the uterine corpus, lower uterine segment, and then the area of the endometrial lining. You noticed earlier that the normal lining should be smooth, okay, and depending on, the thickness will depend on what stage or phase of the menstrual cycle they are. But here, if you notice, may area na parang umumbok, no? Umumbok siya, hindi siya flat. This area. This area. So that's, it can be if we take a section from this area here and then look at it under the microscope, so this was diagnosed to be endometrial polyp. Kasi polypoid siya, okay? Sometimes these patients will experience bleeding, heavy bleeding for them. Yun yung indication for them to have the uterus removed. Okay?
Mayoma na. Adenomyoma yan.
Adenomyoma.
Ito puro mayoma na.
Again, another Tabiso specimen. This is the area of the cervix. If you do speculum examination and take a pap smear, this is how the cervix will look like. The opening of the cervix is called the anatomy, cervical os. Diba? Os, cervical os. So, cervical opening. So, os. Diba sabi ko, dapat ay faluting na kayo magsalita. Ay, pasamit na kayo eh.
Cervical os.
Okay. So, if you do pap smear, ginagawa, nagsuswab dito sa area na to. And then, yun yung nilalagay sa slide. Okay, so yung pap smear. So again,
Shot ng shampoo.
if you notice that the layer of the myometrium is very thickened. Unlike this one here, yung kanina. If you compare, magkaiba sila ng thickness. No? Ito, hindi ganun ka-thick. This is the actual uterus. So imagine a uterus this big to fit inside your abdominal cavity. Okay? So very thickened. And then when this was examined and biopsied, you see a very, very large tumor which was contained inside the myometrium. So this is myoma, but there are blood vessels and some areas of hemorrhage, and this was diagnosed to be an adenomyoma. You will discuss that sa lecture nyo. This is just how it will look like. Okay?
Have 10.6 weeks.
Another myoma, these specimens were collected by your pathologists, by us. Okay, we collected them and showed them to you, for us to be able to show it to you. So the myoma can either be small or very large. Okay, ito yung likod. This is the posterior portion. Anterior portion, sliced, examined. Okay, what do you notice sa surface ng mass? But it's whirly, no? W-H-O-R-L-Y, whirl. Yun yung sabi ni Robbins, yun yung kanyang description. Whirly. Parang it goes in circles. Takes a bit of...
And it's rubbery when you touch it.
very, very hard masses. Actually, kahit na hindi pa sila na-formalize, they're very, very firm, rubbery masses. And can grow as big as this. Ito, myoma lang to.
Hindi pa uterus
Hindi
yan.
pa uterus yan. Walang uterus dito. Myoma lang yan.
Subserous shorts. Ay, serosal.
Okay? Imagine fitting this inside your abdomen. Okay. And imagine these patients carrying the myoma for how many years, no? Sometimes they go to the doctor only when they have bleeding or menstrual irregularities. So this is an example, another example of myoma. Sometimes they tend to grow outwards into the... They can either occupy the lining of the endometrium, so they are called subserosal masses, or they can occupy the myometrium, submucus, or they can occupy the myometrium or just under the serosal capsule. So ito yung subserosal masses, ito yung labas. Okay?
And then
Or intramural. Ito yung maliit. That's inside the muscle. One small tiny myoma. That's intramural myoma. Okay? This is another example of a Tabicho specimen with lots and lots of myoma on the surface, inside. Okay. Yan.
ano yun sa
Placenta na lang. Sige,
placenta
mamaya.
ulit.